Housing for prescription.
By the Paris, listen.
Yes, sir. We were hoping that at least somebody from the what is going on. What? Since they don't want to go up. Since they don't want to come, I'll do them the honors of making sure that it's put someplace where they can see it. So, in 2020 in America, it's in the midst of several pandemics. Most obviously is COVID-19, which is exploiting existing public health disparities, restraining already restrained resources. But on World AIDS Day, as on every other day, we must not forget that America is still in the midst of an HIV pandemic. While infections and deaths from HIV fell steadily since new medications were discovered, trialed, and made accessible to millions, we have reached a plateau in infection rates. And in some locations and some populations have seen them start to creep up again. In addition, America continues to face the ongoing pandemics of public health disparities which HIV and COVID-19 exploits and makes visible, but do not cause. HIV preys on homophobia, transphobia, racism, mass incarceration, and a failed response to addiction. COVID-19 preys on high blood pressure, heart disease, diabetes, and other illnesses that are caused or exacerbated by poverty and racism. And both diseases are contagious, and their spread simply cannot be contained when so many people face unstable, unsafe, unaffordable, and inaccessible housing. Our experience and extensive research on HIV and housing indicates that on each step of the HIV care continuum, housing is a factor in successful outcomes. Indeed, housing has zoomed by many others well-accepted healthcare interventions in terms of public evidence. Housing status is likely the most important characteristic of each person living with HIV or AIDS who seeks services. The most significant determinant of each person living with HIV and AIDS, health and risk outcomes. That was cited by Dr. David Wolfrey. Research on HIV, AIDS, and housing has also shown that housing is cost-effective as well as saving lives, improving the quality of life, and reducing individual and community HIV risk. These same lessons must be applied quickly to the COVID-19 pandemic, and we have already seen how crowded and congregate living situations lead to increased spread of COVID, how people living in nursing homes, many of whom could live independently with accessible, affordable, and integrated housing, are at increased risk. Diabetes, high blood pressure, other heart and vascular diseases. Permanently affordable housing also increases someone's ability to self-isolate, avoid work when sick or potentially exposed to COVID, maintain good hygiene, and help reduce the community viral load. Housing is the most important tool that we have, reversing the health disparities these multiple pandemics have exposed. Our recommendation, Biden, is that you quickly move to enact key components of the Biden-Harris housing plan, meaning A, fully fund Section 8 housing in the 2021 budget. B, create a renter's tax that covers rent and utility costs over 30% of the 2021 budget. C, invest in additional affordable housing in the 2021 budget. D, fully fund Maxine Waters' comprehensive ending homelessness act. And E, to support for rapid rehousing in the 2021 budget. You can also strengthen the biparent housing plan to immediately respond to COVID-19 crisis by immediately stopping evictions and foreclosures and maintain a moratorium throughout the end of the pandemic and the recovery. Moving people into homelessness, shelters, or doubled up housing during a pandemic is a public health nightmare. Cancel rent and ensure that renters and homeowners do not incur diversified housing or utility debt due to lost work during the pandemic. Housing instability and debt will only exacerbate the health disparities that COVID helped to reveal. They immediately increase support states to move people out of congregate housing, including shelters, nursing homes, jails, prisons, and group. Do even more to strengthen protection for renters and low-income homeowners, protecting them from unreasonable rent hikes, no-cause evictions, predatory lending, and other practices that allow profiteers to get rich while people's health and well-being suffer. And finally, promote housing as public health. Ensure that people experiencing or at risk of housing disparities, such as the LGBTQ plus community, Black and brown and indigenous people, disabled people, HIV positive people, and other chronic health conditions have access to permanently affordable, accessible integrated homes. This includes fully funding the Hot One waiting list, which is housing opportunities for people with AIDS, allows system-wide medical cost savings to be reinvested in housing to ensure that housing intervention is cost-effective without tying individuals to housing, receiving supporting services or services, or receiving specific types of housing. And for those who are confused about the last part, what that means is housing first.
Housing first.
That means we need housing if you want us to take our medication. We need housing if you want us to go to the doctor. We need housing if you want us to eat healthy. This housing is the first step in that. And we're here to demand that you listen to our recommendations and move forward.
Housing is a human right.
Fight.
Housing is a human right. 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 I don't need to have AIDS to care about people who have AIDS. I don't need to have COVID to care about people who have COVID. Housing is a human right. Do your job. Protect the people who got you into office. Do your job. We're in a pandemic. We affect each other. We can't stay safe if we don't have homes. We need homes to stay at home. We need homes to prevent the spread of a pandemic. Do your job. human beings out here freezing, begging for basic human dignity. Do your job!
Do your job!
Do your job!
Do your job.
Get out here! Speak to us! Meet us! Human beings! We want to work with you! We got you into office! Do your jobs! Housing is a human right!
Housing is a human right.
Housing is a human right!
Housing is a human right.
That's what I got.
That's all right. I put it on the ratio like it's 50.
I'm from the Philadelphia Overdose Prevention Network, otherwise known as POPIN. We're a coalition of about 10 organizations, as well as medical professionals, students, scholars, and other people who believe in harm reduction as a humane way to combat the overdose crisis in Philadelphia. Humane way to combat the overdose crisis in Philadelphia. Humane way to combat the overdose crisis in Philadelphia. Humane way to combat the overdose. This is a place where people who use drugs can safely be provided with the safer use supplies that they deserve, and they will be treated by a medical professional if they start exhibiting signs of an overdose. But we recognize that this is just one tactic to combat the overdose crisis, and it means nothing if people have no safe homes to go back to, if they don't have stable support systems to rely on, and if they don't have access to the safer use supplies and the resources that they deserve. It's no coincidence that the overdose crisis is concentrated in a neighborhood called Kensington in Philadelphia, where there's a very dense, unhoused population of people who do not have access to the resources that they deserve to stay safe. It is no coincidence that people who use drugs are at higher risk of contracting HIV and AIDS because they don't have access to the resources that they deserve to stay safe. And it is no accident, like our good friend Jose said earlier, that Black and brown people, of course, bear the brunt of this crisis the worst, just like they bear the brunt of the COVID crisis, of the AIDS and HIV crisis, and of the COVID crisis. Our Black and brown siblings deserve housing, our trans siblings deserve housing, people who use drugs deserve housing, because housing is a human right.
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 Thank you.
So, just to make sure that the people who are watching online do know and understand that several people did come out of this building. A couple of whom have badges, so we know they're Secret Service or some kind of law enforcement, which means you're working with the transition team. Any one of those people could have taken our notice for Biden and delivered it to them, and they all refused. So, to make it clear, you were elected on the backs of Black and brown folks. We turned out in droves.
Damn right.
To make sure that not only was the orange clown kicked out of office, but that you were the one who showed up. You and Harris made us promises. We expect them to be kept. Don't think that just because you're in the office, your fight's over with. We expect to see these changes start to occur within the first 100 days.
Right.
We expect to hear from the transition team. Reach out to ACT UP. Schedule a meeting with us. Sit down and talk. Hear from the people who are impacted by the very policies that we're talking about.
We won't give you AIDS. It's not contagious.
As I've learned through the Poor People's Campaign and just life itself, if you're not listening to the people who's in the fight and have the insight, then you will never understand our plight.
That's right.
That's right.
Period. Like, put on full dot on that one straight, period. Go, I'm cold.
The Secret Service guy told Noble that they don't work there.
No, the people, the women that came out the door, they straight ignored me. Dad, y'all on the megaphone that it's on the windshield, so that way they know.
Okay.
How they? Oh yeah, there's cameras.
There's cameras.
Yeah.
Trust me, Wilmington is one of the most healthy towns in the country. They all hit in the building, no one walking. Yeah, we do. Yeah, we do. Of course.
Oh, don't you know what's going on?
Thank you guys for coming.
Thank you, thank you, thank you, thank you.
Thank you, Jose. Thank you for speaking. Mom.
Thank you for what you do.
Where's your car at? It's straight this way. Straight ahead.
I am okay. I have the TV. My daughter is in the same room, so I'm trying to mute until I need to speak here. I'm sorry.
Hello, everyone. This is Zachary Lewis. I'm representing ADAPT as one of the organizers and Disabled in Action. My pronoun is he, him. Shakia, Shakia.
My
All
name
right.
is Amira. I'm with one PA and I go by she, her, and hers.
Great. Thank you. Um,
My name is Shakia, and I'm also with 1PA, and I go by she, her, and hers as well.
excellent. 1 moment, please. Oh, that's the problem. There we go. Sorry, I was having just a technical glitch here trying to figure out something. All right. So let's just go in order of introduction here. Zachary, if you wouldn't mind just talking a little bit about your experience and giving your story for everybody in online and watching the live stream, and also everyone in the Zoom chat.
Sure, I can do that in like a minute, if that's okay.
Sure.
Thanks.
Liam, could you go ahead?
Sure, sorry about that. I am ready whenever you would like me to speak.
Go right ahead.
All right, so you'd just like me to generally go over the disability experience?
Yeah. Why don't you let us know how housing affects you in specific, and we'll go from there. I'll ask you a couple of questions.
Sure. Yeah. So from my own perspective, I'm lucky enough to have a house now. I did not for a while. I use a wheelchair. So housing was really hard to find for me in Philadelphia, because most things are they have steps going up and are inaccessible. So my wife and I, and we have a small daughter, we were able to find something, and we're pretty lucky that way. I think something I do want to highlight today is that nursing homes are a very real possibility for people like me. I'm here, but by the big grace of God. I know a lot of people who are or have been sent to nursing homes, and despite less than 1% of the Pennsylvania population account for almost half of the COVID deaths, and so I'm so lucky that I'm not forced into a nursing home, and yeah. So I have more on that, but I want to make sure. Well, what else do you want?
Would you just, if you wouldn't mind, just what do you think the transition to a new leadership in the presidential leadership could do? What could new leadership in government do that would help or assist you in looking after yourself and your health care?
So I think, on behalf of the wider and disability community, I think greater HUD funding, Section 811 housing is really essential to us, and we'll get there through progressive cabinet appointments. I think that there are some things that need to be tackled on a local and state level. Um, and I think nationally, even we're seeing kind of this erosion of ADA, sort of legislation, Americans with Disabilities Act, around Trump and Republicans in Congress, and so I'm hoping to see that turned around and strengthened. It's the only way that I can live in the community.
Great. Well, thank you so much for sharing your story. Do you have any message for Biden's team? Is there any specific thing that you would like to say to Joe Biden or Kamala Harris if you could speak directly to them?
Yeah, I think I would say that I think we largely gave this victory to them, or we paved the way for them, and so it's up to them now to include us in their own priorities. And I'm glad to see the administration recognizing the COVID disparities. But we need, a total shift, and especially for the disability community, we often go unseen and unthought of when thinking about things, and we need to be included in those conversations.
Excellent. Sorry about that. I had a little audio problem there just for a second. But appreciate your talking to us, and I can go to our next speaker. Zachary, are you ready?
Sure, I'm ready.
All right. Yeah.
Go ahead.
I was just gonna say, just go ahead and let us know what your thoughts are.
My thoughts as far as this administration, I'm sorry, my name is Zachary Lewis, Zach, and I'm the executive director of Disabled in Action, and I'm also a consumer. I'm also, I'm disabled, and I'm a part of this campaign because we need more. At the end of the day, we elected these people, Smoking Joe and Kamala Harris, to not only just speak for us but shine a light on the issues that we deal with. I wear a lot of different hats when it comes to activism, advocacy, and things like that. And I'm happy to join up with this campaign on the back end of Action AIDS Day, just to bring light to the issues that we deal with as far as, with our campaign slogan, housing is healing. And it's just important to shine a light on that. So when that light gets shined and you see what the disparities are in our communities, especially for people that look like me, the Black and brown community as well, it's important that we shine a light on that. So, yeah, I've been an organizer for over 15 years, and I'm also a consumer, and because of me being a consumer, like I'm able to tap into, home and community-based services through the Department of Health and Human Services, and it allows me to live independently in the community. I mean, and thank God for that. But at the end of the day, you know, my message would be to them, especially Joe Biden, when he understands who we are as far as an organization, adapt and disabled in action. We need more. We need more. More funding. We need people to keep talking and push the conversation forward as far as the disparities that are out there, especially with housing. Housing equals healing. There's not enough people, especially, people that live in nursing facilities, homeless. There's not enough housing out there. Section 8 needs to be opened up. We need more. What's out there is not enough. Clearly, it's not enough, or we wouldn't be doing this right now. So, there's a lot of facts and statistics out there that, funding streams that do help us out as far as SSI, SSDI, things like that, but it's not enough. People that, even with SNAP benefits, cash benefits, things like that, they get anywhere in between like $738 to $1,200 a month. That equals about $14,000 a year, or less. And like, it, we need more. It's not enough. I don't know how to say, like, thanks a lot. However, not to like shun them or anything like that, for helping us out, but it's not enough. It's never enough what they're doing. So hopefully when they take this office, they hit the ground running and getting started on the issues that we're shining on them and that we're making so much noise on, our brothers and sisters in this chat, and there's our brothers and sisters that are out there on the street right now that are in Delaware. Hopefully, he hears, not hopefully, but damn it, he has to hear this. And he has to understand we need more. It's not enough. We need more. I'm currently right now in the process of testifying to our city council, but that's not enough as far as getting taxes on a 1% tax that is on housing right now. And, 1% is 1%. However, like I keep saying, we need more. We need more. It's just not enough. The disparity out there is a huge gap between the haves and the have-nots. I'm not trying to be, in that category as far as having and have not. I'm just trying to live. I'm trying to survive. I could be one paycheck away from being homeless. What do I do? A person, a African American male, and a person with a disability as well. The reason I believe we're not talked about enough is because we're not considered sexy. We're not in that sexy category that people want to listen to and shine a light on that. So I don't know. I just believe we need more.
Amazing. Thank you so much for talking to us. You had brought up a very important point, I think, about integrated housing and housing for folks that need healthcare integrated with their housing. Could you tell us a little bit more about that? What that would mean to you?
What that would mean to me is a person getting accessible, affordable, integrated housing. And how that would look to me, first, I would say, as far as the do's and don'ts, once that is provided, the don'ts are to make sure that our healthcare is not connected with our housing, because it locks people in to not being able to have the right to choose. Choosing accessible, affordable, integrated housing is a big deal when it comes to connecting our healthcare with it, because there's disparities out there and people that will say, well, if you're going to live in my accessible, affordable, integrated housing, then you have to sign on with this healthcare system. And having that is just a no. People will do that, the predators that are out there. However, having a right to choose means being able to choose what you want, when you want, on your own terms, regardless. Sometimes if it's a negative, looked at as a negative thing and that works against you. But that disparity is out there with people. and predators. And to me, housing, accessible, affordable housing, absolutely means being able to choose where you're choose an integrated setting, basically integrated on so many different levels. Whether you know, it's always been looked at like that house on the hill is for those people. Whereas though, if we're having an integrated setting, we're amongst the community, we're intertwined with the community. Whatever our needs are, it's a part of the community's needs, whether it be healthcare, uh, whether it be safety, whatever those needs are, it's integrated into the community just as well as everyone else's. So that way we can all be equal. Equality is a huge disparity when it comes to that. I understand that, a lot of activists and advocates say we want this and we want that, but who are the we? A lot of times it might be have good intentions, but the disabled population is not usually concluded in that we. People that look like me in a wheelchair, and especially women. I say myself, I give myself an example, but I understand that, women have the hugest disparity of it all. So we are here as ADAPT and as DIA to represent that with this coalition with ACT UP. I hope I
Excellent.
answered your question.
No, you did. And thank you so much for speaking. I would like to go to the next speaker.
If I can answer anything else, I would too.
All right, we'll have a little group chat at the end of this. And next in my list is Munira. If you could just unmute yourself, and if you want to come on video as well, that would be great. But unmute yourself and go ahead and let us know your story.
Hello. Thank you for inviting me. I actually started. So my oldest son is 16 years old, soon to be 17. And be honest, being I want to actually know what stable home housing is. I want to be able to experience that. So, I don't only fight, for myself, but I fight for my community. I fight for my children. I want them to be able to move out my home one day. And at the rate where I won't be able to be comfortable in a city that they, should be able to say they're proud that they're from. So housing to me would mean like not having to think about what affordable housing means. It should be already given. It should be what we're entitled. Housing is a human right. It really is. So again, not just for my children, my neighbors, my friends, for my family, and that's what housing means to me. And I know that these elected officials that we voted, they can sit home. They can home for the rest of our elected officials that handle things here in our neighborhoods. It's home for them, and set laws that let landlords know that they can't treat the people like that, the constituents, the people that help them get into where they're at. They can't treat the people like that. So that's what I have to say. Thank you.
All right. Well, thank you so much. Thank you for your words. And I've just been told that we're having a little trouble with the live feed, but I'm gonna post a backup feed to the online event, and folks will be able to watch this also in repeat after we come back. Do you have any other messages for the Biden transition team, Munira?
All of us, or any of us?
I was specifically asking Manera, but it looks like we did
I'm
have.
sorry, I broke up.
Oh, okay. No worries.
What did you say?
I was asking if you had any other messages for the Biden transition team.
The only message I have is to listen to the constituents. We, we're going through it. We know how to get through it, and so listen to us.
Absolutely, absolutely. You were Zachary. You had a piece of information about the 1% sales tax. Go ahead.
Okay.
Oh, we lost you there.
Cock-a-doodle-doo.
I'm sorry. I'm trying to mute you guys so you wouldn't have to hear my Alexa act go off.
That's all right.
That's embarrassing. Yeah, I had a testimony yesterday that I was supposed to give to the host asked you to start your video.
Yeah, you turned your video off.
Oh, sorry. Yes,
That's okay.
about a sales tax, a 1% sales tax that, when it comes to construction in the city of Philadelphia or rehabbing, that was supposed to happen yesterday. And I prepared for it, but it never happened. So I had to, email it into city council. And this is regarding a 1% sales tax. I could definitely, speak on it or
Go right ahead.
read it out.
Go ahead.
All right. Give me 1 second to pull it up. I'm sorry. Okay, so I guess you guys already know my name, Zachary Lewis, and I'm the executive director of Disabled in Action. It's a local grassroots advocacy group run and controlled by people with disabilities and our allies. And I'm a proud, motivated organizer with ADAPT. And I've been with ADAPT for about 15 years now. And I'm also a consumer who receives like home and community-based services through the Department of Health and Human Services, which allows me to be living independently in our community. And there's a lot of things that I am, and I understand I do wear a lot of hats, and it's definitely necessary so that way, we can continue our fight for equality. And for me, and a lot of people that look like me that live on like fixed income because of government assistance such as SNAP benefits, cash assistance, SSI, SSDI, that I explained to you guys earlier, it's anywhere between $738 and $1,200 a month, which adds up to about, $1,400 or less a year. That area median income is so low for people to be able to survive on without having to, resort to anything negative out there in the streets, but it's low. Most of the disabled community lives at 18% of the average median income, which is extremely low, like I was saying, but there's a formula for that. Basically, at the end of the day, like I keep saying, it's so low, and we need more resources for that. We definitely need more resources. And these very government-funded income streams, they're crucial. Without them, what do we do? Especially people, who can't do for themselves without that income stream or without getting home and community-based services, which looks like for me, as far as having attendant care, having, an attendant that comes in and helps me do the things I need to do as far as activities, just of daily living. A lot of times people connect that funding stream with having special needs. I don't have any special needs. My needs are basic. I have basic needs that need to be done in order for me to live independently in the community and not go into a nursing home. A lot of people in my group or in my community look at nursing homes or nursing facilities, I should say. When you connect homes to nursing facilities, you consider it to be something that you settle for and something that's warm and comforting when you think of home. But facilities are death camps at the end of the day. They are places you don't want to be, especially right now with the COVID rates are going up and down. it's an alarming rate in this bill that I was supposed to speak on. It helps with that disparity. Even though it's only 1% of construction, if you look at those numbers and understand how much construction that goes on in the city of Philadelphia, and then if we're able to tax that 1%, I think it's a great thing. I I think it's a great thing. Being a part of the Philadelphia Coalition for Affordable Communities, I buy into that very much. I believe the saying that there's strength in numbers and there's safety in numbers. And with a tremendous amount of support together, we're developing a strong Philadelphia Housing Trust Fund. And that Housing Trust Fund will be able to go and help purchase housing for people that would help with the disparity with homelessness for people, trying to get out of nursing facilities, for helping people with home modifications, activities of daily living. It just, those things go so far to help people with their independence. It might sound like a lot of things, but they're simple, basic needs. And I wanted to explain to them that I was here to testify in favor. It's a bill 200556. And in an ordinance, it would allow the Philadelphia Housing Trust Fund to receive that 1% sales tax on all construction in Philadelphia. Not just, houses that are going up, but rehabilitation too. So that's constantly, people are constantly building and tearing down things. But imagine when they're building, that money, those monies that they're using for that construction, and when they're paying for those sites from the city, will be able to tax that by 1%. So I think, it's only 1%, but it's a start.
Awesome.
So yeah.
Thank you. Thank you for speaking to that. We really appreciate it. And if everybody is still here, if anybody has any additional comments or would like to join the conversation, I don't believe I introduced Jerome. Jerome, are you available? Not hearing from Jerome just yet, but all right. So and Liam, if you would like to jump back on, I can add you to the conversation, and Zachary, you can feel free to stay on as well, and we can just have a little quick conversation. So I just wanted to ask what everyone thought of, like, what are your main concerns when it comes to housing security? Like, what does, when you're feeling housing insecure, what sort of issues does that create in your life? Sorry if I'm not pulling out the words very well. But yeah, what kind of things could you do if your housing was more secure? And everybody can just jump in and talk as you like. I'm not gonna, we'll just hold space for each other. And so feel free to unmute yourself and talk on the issue as you'd like.
I can speak a little bit to the disability experience. To us, housing insecurity means death. I mean, like a lot of Philadelphians, a lot of Americans, but there's an institutional bias in America, which basically guarantees federal funding for housing only in institutions for people with disabilities. And it's harder to find accessible housing on the outside. And so many people with disabilities who can't find accessible housing are forced into nursing homes And right now, the death rates are so high. I think, Zach kind of pointed this out before. But we've seen almost half of COVID deaths be to people in institutions, and that could be me. They could be my friends. I finding secure housing on the outside, finding it integrated and affordable and accessible, not just financially but physically accessible, is the only way to guarantee life in the community.
Awesome. Anybody else?
Yes. You were asking how would it feel to have the housing security?
Yes.
Well, if you have housing security, I feel like it could be a huge. Wait, I'm sorry, I'm getting kicked off here. I feel like it could be a huge weight off your shoulders when it comes to how you are going to provide for your family. Your mindset changes a little bit if you don't have to worry about housing, or if you have to worry about housing, then there's also going to be an issue as far as you're going to have to worry about how to be able to feed yourself and feed your children as well. Like that is a big issue towards though, your mindset starts to change on how you can handle other issues or tackle other issues that are, dealing with being able to be independent and secure, whether you have a disability or not. If that housing is secure, then you're able to move differently. You're able to think differently on how to be able to provide best for whatever your situation is.
Excellent. Thank you so much. And Munira or Jerome, if you have any thoughts or would like to say anything, feel free to jump right in. All right. Not hearing anything else. I'm just gonna kind of wrap up here. We've had a great event. We've had some live coverage from folks trying to deliver a prescription for housing and healthcare to Joe Biden's transition team in Wilmington, Delaware. We really appreciate you all for tuning in and watching what we're doing, witnessing what we're doing. And the video of that was right at the beginning of this broadcast, so feel free to watch the rebroadcast and to tune back in to the various places where this is going to be. This will be on ACT UP's YouTube channel, ACT UP's Facebook page, the Mob Crush account for ACT UP, and Twitter, Twitch, various other places. You can find it almost anywhere, and it's also duplicated onto my production company's accounts, Light Thief Productions. Happy to help bring this message out to everyone. If you would like to help to deliver this message to the Biden transition team, to deliver this message to the new federal government, the new presidency, to your state legislators, to your city representatives, they're all very important people to contact and to get your message out. ACT UP wrote a memo, which was posted yesterday on ACT UP's Facebook page and Twitter account and website. So please go ahead and take a look at that memo, and feel free to duplicate that memo, send it in yourself. I mean, one thing that really impresses a lot of politicians is if you actually send them a physical letter I don't know why that's so impressive, but it does help. So send them a letter, send them an email with a copy of the memo. Let them know what having housing security would mean for you, what having housing security would mean for your community. And if you want to join us, subscribe to ACT UP's Facebook to get notifications of when they go live and when there are other actions. And please support all of your fellow human beings with just the support of supporting ACT UP's message and getting it in front of people who can actually do something about it. We need housing security for healthcare to support the health of everyone, and we need that message to get to Joe Biden, Kamala Harris, the new Senate, the new Congress, even our city council representatives in Philadelphia or wherever you live. We should be giving this same message to everyone. So that's all we have here from Philadelphia and Wilmington for the day. Again, please review our action if you didn't tune in early enough to see the beginning. And we look forward to helping everyone get the housing and healthcare that they need.
James, I was gonna say also, I put my contact information in the chat. Being executive director of Disabled in Action and an activist with ADAPT, you can always, if you guys want to work on helping with that gap and helping change that disparity, you could always reach out to us. And we're doing a lot of things. And we're working on a lot of campaigns to help with transitioning people from nursing homes, and also not just people that are living in nursing homes, just everyday people that are in need of services or housing. So
would you like me to put that up on screen for folks?
You can if you want, I don't mind. But yeah, if you want to give us a call and reach out to us, we're more than willing. And if you guys have like a bug or a passion for advocacy or even activism, please join us, give us a call, and we can bring you into the fold. That anger and that frustration that you guys have and that passion, it's like, how do you, sometimes the question is like, how do you direct it? Well, we definitely have a way for that.
All right, if you hang on one second, I'm just going to bring that up on screen for everybody. Wrong button. Sorry about that. So yeah, actually I'll just post it to the chats, and hopefully everybody can duplicate it from there. Any other final closing thoughts from anybody?
I thought it was a great opportunity to hear a couple people speak. Are we going to be able to get back onto that live feed outside?
Yes, you can see the live feed on the Facebook page, as well as you'll be able to watch the rebroadcast of it. Like it will be saved on the Facebook page and YouTube, Mob Crush, Twitter, via Periscope, etc.
I mean, now, like, are they still out there?
Oh yeah, yeah. Oh, you mean the in-person action?
Correct.
I'm sorry, I was a little confused there. So yeah, I'm just gonna switch microphones real quick. The in-person action did wrap up before we came to you speakers, and so to watch the in-person action, just go ahead and tune into the live broadcast, the replay of the live broadcast, and it'll be at the top.
Thanks.
All right. Thank you, everybody, and thank you for joining us. And tune in next time, and we'll have more actions for you, and we'll have more calls to action. So thank you to our guests, and thank you everyone who spoke and who did the action in person. We really appreciate it. And we look forward to seeing you again soon.
Thank you.